Hello, everyone. Thank you for joining. We are here to talk about what you need to know for holiday and travel safety. My name is Camille Lang. I am with the San Mateo County Health Department, and today we have a series of public health as well as other resources available to you that we will be interacting with throughout this live stream event. Thank you so much for tuning in. As we get started here, please type in the chat where in San Mateo County you are tuning in from and how you are planning to change your holidays and adjust your plans to be safe this holiday season. Please share this broadcast and follow us on YouTube, Facebook, and Twitter at SMC Health to stay connected and get the latest updates. Thank you again for joining us. This is a live stream event talking about what you need to know so that you are prepared for holiday and travel in San Mateo County and coming back into the county after those travel plans. Please let us know where you're tuning in from. Where in San Mateo County are we seeing people tune in from? We'd love to hear that in the comments. I see Stacy is tuning in from Half Moon Bay. Welcome, Stacy. Thank you for letting us know. We're happy to have you here and excited to make sure you are staying up to date with all the information we have available for you on how to do the holidays safely. Great. All right, again, my name is Camille Lang. I am from the San Mateo County's Health Department. Here we have gathered public health officers, San Mateo County Parks, and other COVID-19 resources that the county has available for you so that way you can participate in holiday gatherings safely. I'm seeing that Rachel is planning to have a Zoom hangout with family. Thank you for sharing, Rachel. Patricia is tuning in from Pacifica. Welcome. Heather from Pacifica, we're happy to have you. And Joni from Bradley, thank you so much for joining us. All right, with that, we have our first guest, Dr. Curtis Chan, is the Deputy Health Officer from San Mateo County. Hello, Dr. Chan, thank you for joining us.
Great to be here.
All right, Dr. Chan has some information here for us so that way we know what we should be doing for the holidays. Dr. Chan, please take it away.
Great. So thank you so much. I know that many of you are community leaders throughout San Mateo County. So with the next slide, can you forward it? So what I'm going to do is, since you're all community leaders, is to provide an update of 8 important scientific points that weren't available even a few months ago, and we're really starting to understand the information now. So I just want to share this information with you so you can empower your community members, other community organizations to really make their best decisions. So there's 4 basic science ones, and then there's 4 kind of broad local epidemiology science points. So the first thing that we know a lot different now than back even in May is that this virus is not just only large droplets, but it's actually small droplets. And I'm saying all these things because this is going to relate to the actual guidance and health officer orders that we have for masks, why things are closed, why we want to have small, stable groups for the holidays. And this is really the rationale. And I would love to get your feedback about how we can explain these concepts that are really complex to the broader San Mateo County community. The second point is that this is very infectious. We're now learning, I would say that it's probably twice as infectious as seasonal influenza with the R0 of 2.5. A really big, the third important point that we're understanding now is that most of the transmission actually occurs before or without any symptoms. So this could be transmitting within households. This could be transmitting even within your social bubble, friends and coworkers. But this is the reason why we need to be wearing masks all the time and need to be wearing masks, particularly when you're talking or shouting or communicating with other people. It's this fact that at least half of the transmission occurs when you don't have a cough or a runny nose. So all those things about coughing into your sleeves, those are really not the only things that need to be done. So that's the actual concept. The fourth concept is like, I think initially we were super concerned. We heard about case fatality rates of like 3 to 4%, and we were, as physicians, completely alarmed. We thought it would go a lot lower as we did more testing. It's gone a lot lower, but not nearly as low as we had actually hoped it would be. You can still see the case fatality rate is 1.8% in California. And when you think of infection fatality rates, they're still extremely high for older adults, those who are over 50 years old, and those who are over 70 years old. If you're getting infected and you're amongst the people who are getting infected who are over 70 years old, the risk of dying is about 5%. So that's really alarming. And I think that's this marriage of both being transmissible before symptoms and that possibility of transmitting this disease to basically great uncles, great aunts, and grandparents is the biggest concern that we have in public health right now. But that's really the rationale for things. Local epidemiology, you're all hearing about this surge of cases in November. It's no longer just in the Latinx community or primarily amongst essential workers. It's in all of our communities now, suburban communities, all ethnicities. A big important thing that we're hearing about is that PCR testing was very difficult to get testing even 3 or 4 months ago. It's now much more widely available at your physician's office and also in our community testing sites. We're going to learn about that. The big thing is that we need to get through this difficult hump of the holidays. And then hopefully that effective vaccine we're hearing about is in the horizon. So hopefully we don't have to be in this desperate situation for too many months more. But we really need to work together these next 2 months through the holidays to get us to that point. So, and we also realize that toxic stress is super high right now, and we really need to support each other, love your neighbor, and support your families and friends. And this is why we have this specific holiday guidance in the next 2 slides that will balance both the science and how all of you as community members can lift and support your community. So the next slide. Thanks, Camille. So you could see the direct relationship from the science updates to why we have some guidance for holiday gatherings. We want to keep holiday gatherings small, maybe to only to your household or your small social bubble, because so much of the transmission occurs without symptoms or before symptoms occur. And when you're taking off that mask to eat and shout across the Thanksgiving table, that's when that transmission occurs. We want to keep it stable. Try to stay within your social bubble, for a tight social bubble for the meal. Possibly if you're going to enjoy one of San Mateo County's wonderful outdoor parks, you're not eating at that time and taking a walk outside with 1 or 2 other close friends or 1 or 2 other families. That might be a much more better approach than sharing Thanksgiving in a crowded dining room together. We're also learning from evidence that each time you talk, you just spew out a little bit of virus. But cumulatively, if you're in a room for more than 2 hours and you're taking on and off that mask, there seems to be a large increase, if it's like a long amount of time, let's say 2 hours. So this is why we want to think about gathering outside for the holidays and other guidance for the next several months with the next slide. So again, it's not just these holidays, these 8 science concepts that we all need to learn together. How do we and local government and community leaders, you all are, empower the community? We know that masks prevent transmission. We've learned this for a long time now. The key points are with or without symptoms, and particularly when talking are some points that we need to emphasize. We've talked about the holidays. We need to limit the number of exposures. We want to avoid travel when you're in the airports and multiple different restaurants. We want to limit the size of gatherings. How can we dine within your own household? And let's go enjoy some sunshine and good weather outdoors at our San Mateo County parks. It's important that as soon as you feel some symptoms or you think you've been exposed, go get tested for COVID-19. If you have any symptoms or concerns, the new CDC guidance is if you think you're concerned too about being infected, isolate yourself from other household members, from other work, as more tightly, isolate yourself from your social bubble, your work bubble, and get that test as soon as possible. But even before you get that test, make sure you're not infecting other people at that time, particularly those who are elderly, because those who are elderly during these holiday times when they're already have been socially isolated for the last 8 to 10 months, it's important to love and support them, give them a call, teach them how to do some video chat, write beautiful letters, send gifts galore. If you minimize exposures, we could do this. And if you're going to visit them, if you have to visit them, support them, the best thing you can do is to isolate yourself, limit exposures from other people for 14 days before. So I'm going to listen to the rest of the presentation, and I'll be looking at the comments too. So thanks so much for sharing this time with me.
Great, thank you so much, Dr. Chan. We really appreciate you here, and we're seeing a lot of gratitude in the comments for the information that you're sharing and making it easy to understand. So we really appreciate your time. Thank you, everyone, for tuning in. This is what you need to know so that way you can celebrate the holidays safely and travel safely during the pandemic. We just heard from Dr. Chan, and we have Nicholas Calderon from San Mateo County Parks here with us to let people know about the resources available within San Mateo County Parks. Nicholas, are you there? Great.
Thank
welcome.
you. Thank you for having me. So once again, my name is Nicholas, my name is Nicholas Calderon. I'm the director of the San Mateo County Parks Department, and we have just a few slides that will show you, kind of walking you through what the department is and the services and the facilities we have to offer. So the San Mateo County Parks Department manages 20 parks throughout the county of San Mateo. It's about 16,000 acres of land, and we strive to provide a safe, welcoming, and friendly environment to everyone, whether you're looking to go for a hike, a walk, ride your bike, have a family picnic, or just let your kid burn some pent-up energy off on the playground. And because we know that these are activities you want to do on a daily basis, we're open 365 days a year, including holidays, including Thanksgiving. And so we really want the public to be aware of the services we provide, because what we know is that outdoor interaction and outdoor activities are safer than indoor activities. And we want to make sure that we're providing that great service to everyone. Next slide, please. And while outdoor activities are safer, there are definitely some things we would like the public to be aware of when visiting our parks and when recreating in our parks. And the first one is what you've been hearing from us for a really long time, and that is please wear your face covering or your mask when you're in our park, and do everything you can to maintain that 6 feet of distance. While outdoor is safer than indoor, it's still a risk. And there's something, it's not just about protecting yourself, but it's also protecting your fellow community members. So it's really important that we strive to wear our face coverings, maintain that distance, and do everything you can to limit your recreation and your picnicking to just the house, to just the individuals in your household. We are also really excited that this month we open the 10 playgrounds in our system. So our playgrounds are located at Coyote Point in San Mateo, Friendship Park in North Fair Oaks, Flood Park in Menlo Park, Hutter Park in Woodside, Junipero Serra Park in San Bruno, Quarry Park in El Granada, and Moss Beach Park in Moss Beach. And while it seems like that's a lot of information to remember, we have our website at the end of this presentation. You can go right to that URL and find all the information you're looking for. And there are a series of rules that the state has handed down that we that we enforce at our playgrounds, including masks and social distancing, and that children must be accompanied. And it's a lot of information to remember. We have some of them here on the screen, but what's important is when you go on our website and when you arrive at the playground, all those rules are going to be laid out. And it's really important, again, that we as a community are following those rules, because as Dr. Chan was saying, right, there's a lot at risk, and there's a lot of people who can be impacted by this, and we really want to make sure that we're keeping our fellow community members safe. And then lastly, and something that we're really excited and we're just rolling out today, is that we are opening some of our small gathering sites. To be exact, we're opening over 110 sites across 7 parks. And the reason we're doing this is because we want to provide an area outdoor where people can congregate in small, safe groups instead of doing it indoors. And we know that throughout the county, there are a lot of high density housing where they may not have, residents may not have the ability to congregate in a dedicated outdoor space. Well, now you do. You have San Mateo County parks, and so across the 7 parks, like I said, we have over 110 sites. The parks include San Pedro Valley, which is in Pacifica, Quarry Park in El Granado, Junipero Serra Park in San Bruno Mountain in Daly City, Friendship Park in North Fair Oaks, Coyote Point in San Mateo, and Flood Park in Menlo Park. Now, it's important to note, no reservation is needed. We're not charging a fee for use of the reservation sites. San Pedro Valley, Junipero Serra Park, and San Bruno Mountain do have and Coyote Point have a vehicle entrance fee of $6, but there's no fee to use the site. And we're asking that people be aware of the rules of these sites. So no more than 3 households per site, and we're capping the amount of 30 individuals. You're not allowed to mix groups. So if you have a site and your friends have the site next to you, you can't make a kind of a super small group by combining those 2 groups. And we're also asking that people maintain wearing their face covering when they can, and that shared items should not be used during the gathering. So you should plan accordingly and have food prepared and packaged in a way that each table has their own food. And by following these really simple rules, we're able to do everything we can to keep people safe. Like we said, I can't emphasize enough that we really want to create an area where people can congregate in these small, safe groups outdoors. And so that's what we want our parks to serve as. So that's my presentation, and I'll be happy to answer any questions that anyone may have at any point.
Great, thank you so much, Nicholas. We appreciate you being on this call and sharing this valuable resource, our county parks, for us. I also wanted to mention that San Mateo County Parks is waiving the entrance fee the day after Thanksgiving. Is that correct, Nicholas?
That's right. So the day after Thanksgiving is often referred to as opt outside. REI started that, and a lot of agencies have picked it up since then. And so on the day after Thanksgiving, access to all of our parks are going to be free, and we encourage you to go out and even explore a park that maybe you haven't been to before. We have such beautiful parks with such unique environments, and if I don't say so myself, I think we have some of the best parks you're ever going to find here in San Mateo County. So definitely encourage you to go to our website, smcoparks.org, and find a park you haven't been to and go check it out.
Great. Thank you again. We appreciate you being here on this call.
Absolutely. Thank you.
Yeah, of course. So I see that there are a lot of questions in the chat. We encourage those questions, and we look forward to getting back to you to answer the questions that you have. Please feel free to keep adding questions into the chat. And I think we saw one question that I think it would be best to have Dr. Chan answer. Dr. Chan, would you mind coming back into the studio for us here to answer this question? Mm-hmm. Great. So we got a question that is asking why there are no mandatory travel guidance over the holidays. Do you have any insight for this one?
That's something that the state and federal public health departments is thinking about. We don't have a mandatory, so we have a recommended quarantine after you return from travel for 14 days. But, I think it's a philosophical question of when government needs to restrict travel to, I think the question was Maui or not. So, and that's really a question for Maui if they want to have importing our high number of cases in California to Maui.
Great. Thank you so much, Dr. Chan. I appreciate it. All right. And we have a few other COVID-19 resources that we would like to present to you all so that you can stay safe and provide the resources that you need to protect yourself and others during the holidays here. I would like to introduce Megan Ghosh from the San Mateo County Manager's Office of Community Affairs. Megan, are you there?
Hi. Yes, I'm here. Thank you.
Great. Welcome.
Thank you. Okay.
All right. So, oh yeah, go ahead, Megan.
Go ahead. I was just going to, if you want to start the slideshow, I'll continue.
Sounds great.
Great. Thanks so much. So I'm here today to talk to you a little bit about what we do in the Office of Community Affairs. You may not be aware of what we serve, but we act as a liaison between county departments and our community. So we really want to facilitate information sharing and gather feedback and give that back to our county departments. And so a main focus of our work right now is providing education and outreach about COVID-19 to our residents. And to help with these efforts, we have funded 34 community-based organizations, and these are trusted messengers in our most vulnerable communities. And the way we identified these communities was to use the California Healthy Places Index, and that's the map you can see right now. And this is a composite measure of various socioeconomic opportunities, and it's applied at a census tract level. This index includes information such as economics, social, education, transportation, housing, environmental, and neighborhood sectors. And using this data, we split the county into 6 regions and then funded our community-based organizations to assist in each of these specific areas. Next slide, please. And so what our funded partners will be doing is providing really grassroots, micro-targeted, action-oriented approach to reach these communities disproportionately impacted by COVID-19. And the intentional focus on reaching culturally and linguistically diverse communities, such as Latinx, Asian American, unhoused, seniors, and we want to make sure we do this in language. And so these are just some of the things that they'll be doing. It's canvassing door-to-door with educational materials, distributing personal protective equipment, doing virtual education, lots of pop-up testing around the county, and then social media and kind of radio and TV ads. Next slide. So we combined the HPI data, the Healthy Places Index, with our most recent COVID case information. And we have created this mask mobile. And what we do is provide masks and, more importantly, educational information about resources and testing for our residents. And we do this in, the materials are available in English, Spanish, and Chinese. So we look for locations that really need this information. Every week we post where we'll be in the county on our Twitter feed, and I'll know they'll share that information of what our handle is soon. But since we began this mask mobile efforts back in August of 2020, we've distributed almost 14,000 masks to county residents. And we want to make sure that everyone has access to face coverings to help keep our communities safe. Next slide, please. A large part of what we're doing is creating or adapting educational materials using CDC, state, and local messaging. And then we're translating it into multiple languages and formats. All of these materials are located on the county's website, and they'll share that information later as well. But just, you can see a few of them right here. We have testing information. Each of the masks that we distribute, we have individually packaged in a plastic bag. And then in the bag, along with the mask, we have testing, postcards, we have resource information so they know where to go on our website, as well as sometimes answering the call and other items as well. And in addition to educational materials, we're really gearing up for the holidays, and that's what this briefing is all about. And so we're finding information that seems to provide cultural observances and holidays, because it's not just Christmas, it's Hanukkah, it's Kwanzaa, it's all different types of cultural observations that we really need to have resonate with our communities about how can you meet or celebrate in different ways. And so this is part of our toolkit as well that we're providing to our funded organizations. And then lastly, whenever there is new messaging that comes out, so just as of Monday, the county had new guidance as far as gatherings and travel. We take this information, we quickly kind of put it into a flyer, and we want to push this out to all of our cities, our community-based organizations. We tweet it, we put it on Instagram, and then again, this will be provided in Spanish, English, and Chinese as well. And so these are some of the things that we're doing to help our community be aware of any changes in messaging, what's the latest information, and really kind of distilling it down into an easy to understand format. So thank you.
Thank you so much, Megan, for all the resources you presented. It's great to see so much connection in our communities and providing so much support for everyone impacted by COVID-19. Thank you. Great. And so as Megan mentioned, please follow Community Affairs on Twitter to get more information about the Maskmobile and stay connected and up to date on all the information that they have. There was a question in the chat that I wanted to address. Rachel asked if there were any parks that are still closed from the CZU fire. Nicholas, do you have any insight on that?
Yeah, so at this time, Pescadero Creek County Park is still closed and will be closed for the foreseeable future due to the fire. And Memorial Park and Sam McDonald will be opening shortly. They are going through their final winterization process, and we'll be getting those open as soon as possible. But once again, Pescadero Creek County Park, which was the park that suffered from the fire, will be closed likely for several more months.
Great, thank you.
Of course.
Awesome. All right. Another resource that we wanted to make sure everyone knows the most about is COVID-19 testing. We have Peter Shi from San Mateo County Health joining us on the call today to provide some more insight on the testing resources that are available. Peter, are you there? Oh, I see you. Oh, Peter, you're actually muted at the moment.
Good morning, everybody. Really appreciate everyone that's joining by Facebook. It's great to have so many people engaged in this session. Wanted to echo Dr. Chan's recommendations, and that it would be really helpful if you treated everyone outside of your immediate family like they're positive with the virus and really follow the guidelines. It's going to be really helpful. One of the things that what's great about our county is many of our residents are insured and have access to healthcare services. We want to strongly recommend that if you have any concerns about having the virus or being exposed, that you go directly to your healthcare provider to get tested. Because if there's anything that happens to you as a result, your provider knows exactly what your status is and can help you deal with what to do next. One of the other things that we've done in the county since the beginning of the pandemic is expand our testing capacity. And we've also worked with our providers in the community to expand their testing. And so there should be no concerns about accessing testing in this county. And we don't see any foreseeable concerns in the future either. And so we really encourage access to testing through your provider because, again, the connection back to your provider is important. And for those who are concerned about costs, the reality is that the insurance companies have all been required by the state to pay for testing. So it should be no cost to you as the insured person or as a resident of this county. One of the most important things about testing is being able to make an informed decision. And if you're positive, you should quarantine, isolate, and stay away from folks that you care about and love, and keeping them safe from being infected too. So one of the things that we've done in the county is to stand up community testing. And that has been, that has grown tremendously through the last few months. And the testing that's at Project Baseline and also at Curative is really for those who have challenges accessing testing through their providers. And so we've made it as easy as possible. Curative is testing people that are 5 years and older, and Project Baseline tests only 18-year-olds and older in this county. So the signing up process is really easy. And there's 2 sites at the event center, Curative drive-through and then a Project Baseline drive-through. And then we have a Verily team that travels around the county at various locations like Daly City, Redwood City, East Palo Alto, and San Bruno. So there should be no barriers to testing. So we hope that if you need to be tested and you can't get testing through your providers, that the community testing is available to you, and it's a great resource for you. So thank you for, again, being part of this live stream, and happy to answer any other questions.
Great, thank you so much, Peter. Thank you for presenting this resource. I'd like to invite Dr. Chan back. And we did get a question in the chat that I think would be good for both of you to answer. The question says, what about for people that don't have healthcare providers? We can have people participating that are not insured.
Correct. And so we made it super easy at our testing sites. If you don't have internet connection, you don't have a phone, email, we can still get you signed up and tested. We don't want to turn anyone away at our testing sites, and we're happy to help any way we can. And so we don't want testing to be a barrier for anyone. So we made it as easy as possible.
Great, thank you so much. Dr. Chan, do you have any other thoughts you would like to add to this? Oh yes, go ahead, Dr. Chan.
I think Peter answered it perfectly. No, that's great.
Great. Another question came in. How are we communicating free COVID testing to Spanish-speaking communities? I'd like to invite Megan to answer this question to talk more about the outreach we are doing with Spanish-speaking communities. Megan, are you there?
Yeah, thank you. So yeah, I failed to mention that one of the things that we were doing when we look at census tract information is we can drill down and we can see the primary languages spoken in each census tract. And so we target those tracts by providing in-language resources. So we can look at largely Spanish-speaking communities, and we can mail them flyers and information in Spanish. We're also working with our community-based organizations that are in our most vulnerable communities, and they are also providing that information in language. So all of our resources are in Spanish, English, and Chinese right now. And we're posting information on our website, on our Twitter feed, on Instagram, and then every Monday we share all of our most recent information with each city, each public information officer, the school districts, all different types of organizations, so then they can then share that with their networks as well. And again, that is in Spanish, English, and Chinese.
And I just wanted to add also to that, we were able to secure a Curative mobile testing van where 5 of the employees actually speak Spanish and also Cantonese. And we are going to the communities where transportation is also an issue. And those are happening Tuesday through Saturday. And we have been going to where Megan has shown some of the more vulnerable communities. So we are being culturally sensitive with language proficiency and transportation challenges. And so the county will continue to do that throughout the next few months.
Fantastic. Thank you all so much. There was one more question that I saw come up in the chat. For folks that don't have phone or internet access, how will they get the results for their test?
Great question. Curative will actually provide you an 800 number, and you can call in for those results. That's
great. Thank you so much. All right, I would like to invite Nicholas Calderon from San Mateo County Parks back onto the into our discussion here. I wanted to, again, thank you all for tuning in. And we really appreciate the information that was shared here and all the curiosity that we see in the chat as we're discussing the holiday and travel safety guidance that we have for San Mateo County. Dr. Chan, I'd like to invite you to provide some final words here before we end our event.
No, I just want to appreciate all the comments and private chat that's been happening. As you all know, this pandemic is affecting every part of society, and it's going to continue to affect San Mateo County for the next at least 12 months, even with a very effective vaccine. And several of the questions relate to having fines and having mandatory quarantines. And one important aspect of that is how effective is government in doing the enforcement and doing arrests or having fines. And we've utilized an unprecedented use of health officer power since March. And we do realize that a lot of the power is not really in the health officers, but it's really in all of you as community leaders. So, and a big piece is to have conversations like this, to ask good questions for us to continue to think about. There's no really right answers for anything. And, we do need to balance the increase in toxic stress that our entire community is feeling with also curbing the amount of virus transmission. And just a good example in the questions of how we tie it together is that, although I would love for every single person to have a mask covering their nose and mouth during all their trail hikes, we realize that, but we also don't want somebody who's just hiking along who just gets passed for 2 seconds and somebody's nose isn't completely covered to be completely stressed out, and that ruins their day and that they need to seek testing right away. And that's where that science piece comes in. That's really difficult to understand, but we're going to start having more conversations about this. That little teeny bit of virus is most likely not going to cause an infection if exchange crossing the trail. But to another question, if people are going to markets, a food market, and everybody's not wearing a mask, since everybody's coming in, everybody just spewing out a little bit of the virus, gradually the workers who are there, if they're not wearing N95s masks, they may get infected. So that's why it's really important for us to protect all of our workers. Those are grocery clerks, those who are in the parks, those are in childcare and schools, that people start wearing those masks because it's cumulative, right? So if everybody wears masks, we could dramatically reduce the amount of infections. And we have all these other things that public health is working on to making sure that indoor places have good ventilation, that we have good testing available. So I think that's just an example of why science, if we're all trying to learn science and communicate science with each other, we'll be able to understand how to protect workers, how to protect family members who might be gathering for Thanksgiving. And that's where that 2-hour principle came in. It's hard to explain within 7 minutes, but I do appreciate your questions. And that's what's going to inspire us in county government to work better to better serve you for the next 12 months.
Great. Thank you so much, Dr. Chan. Thank you, Megan, Peter, and Nicholas for also joining us today. We appreciate all the people that have tuned in to create more effective and safe travel plans as we look towards the holiday season and protecting ourselves and others from COVID-19. Thank you all for joining us, and stay connected at SMC Health on Twitter, YouTube, and Facebook to stay up to date and the most informed as new updates develop. Thank you, everyone.